Hi, I'm LALITHA Raja, working as an assistant professor at CAs and Linguistics in ANNAMALAI University. Today, we are going to discuss about the topic learning disabilities. Learning disabilities is a very confusing term for school teachers. The children who are having slow learning is also often confused with learning disabilities. So, we have to understand actually what learning disabilities are and what is not. Coming to the problem of learning disabilities or learning problem, it is a lifelong condition because it is of neurological origin. The children with learning disabilities have some neurological issues from their birth. They have an interference of verbal and non-verbal abilities. They also have a problem they doesn't have a problem in intelligence. Their intelligence is of average and above average, and they have a very significant discrepancy between the ability and achievement. Generally, the children with learning difficulties are always having a very good ability in all the levels, but their achievement is very low. So, we should also understand what this problem is not. It is not a mental retardation. The children with learning disabilities do not have a problem in cognitive issue. They don't have a cognitive delay. This is not due to any visual or auditory impairment. These children have a processing problem related to auditory and visual issues, but they don't have any impairment in auditory and visual part. They are not subnormal children. They are typically developing group. So, the children who are having learning disabilities, they exhibit a disorder in one or more of their basic psychological process which are involved in understanding or in using their ability for speaking and writing. These problems are manifested in listening, thinking, talking, reading, writing, spelling and arithmetic. These children also show discrepancy between achievement and their intelligence. They have a normal or an average and above average of intelligence, but they have a problem in achievement, as I have mentioned earlier. The handicaps such as mental retardation, visual and hearing impairment and other emotional behavioral disorders must be ruled out. Our children with learning disabilities are having psychological processing disorder and they pursue central nervous dysfunction. What are the causes for this problem? Generally, it has been known as a genetic issue, but nowadays we were able to see that the factors which the parent has during the time of pregnancy also lead to learning disabilities. During birth, that is birth delayed delivery, also because of the delayed delivery, the children used to have a problem in oxygen. The child undergoes oxygen deprivation, which leads to the complication of learning disability. Also, the factors in early childhood like emotional issues and stress related issues in the environment also leads to the problem of learning disability. And the main issue is also a brain trauma or tumors, which are considered to be the rare issue in the childhood. And also the other issues related to the learning, like the difference in learning method what a human has, like some we used to have visual learning, some used to have auditory learning, some used to have kinesthetic and tactile way of learning, which makes the children to have a different way of learnings, also leads to learning disability. And the types of intelligence also is having a prominent role in this. Generally, human has 8 types of intelligence, and the children who are high in linguistic intelligence used to perform well in the schools when related to other type of intelligence dominance. So this also may lead to the issue. The processing deficits, as I mentioned earlier, like auditory processing deficiency and visual processing deficiency also leads to the problem. The main issue is the hemisphere dominance. The hemisphere dominance is a human has 2 hemisphere, and according to Grace and Wheatley, he says that the right hemisphere thinks in images and the left hemisphere thinks in words. So 80% of children with learning disabilities are right brain dominance, but they use their right hand for their writing and other issues. What is the problem related to this right hemisphere and left hemisphere? Generally, it has been in the research proved that the skill of handwriting, symbol, language, reading, phonetics, locating details and facts, talking and reciting, following directions, listening, auditory association, all are related to the left hemisphere. So left hemisphere has all these skills, and the right hemisphere has the skill of haptic awareness, spatial relationships, shapes and patterns, mathematical ability, computational ability, color sensitivity, singing and music, creativity, visualization, feeling and emotions. So more of artistic skills are related to our right hemisphere, and language skills are related to our left hemisphere. So children with right hemisphere dominance are having the issues related to the language learning skills. So as I have mentioned earlier, the right brain always thinks in visual images and left brain thinks in terms of words. Let us look at this chart. Let us say the color, not the word. So you have to say only the color of that words which has been shown in this screen. Can you just attempt it? Generally, there is a right-left conflict in our brain while we are reading this. Your right brain always try to say the color, but your left brain insists on reading the word. So while you are reading itself, you can understand if you are morely concentrating on the letters, then you are a left brain person. And if you are going to concentrate on the color, you are a right brain person. And this always have a problem in coordinating while you are reading and learning something. So coming to the base of the problem, our brain has different parts, namely frontal lobe, temporal lobe, frontal lobe. You can see this part as a frontal lobe, parietal lobe is this part, and occipital lobe is this part, and temporal lobe is this part. So whenever we see a stimulus or hear a stimulus, when we hear a stimulus, it is reaching this temporal part, and when we are visualizing a stimulus, then it reaches this occipital lobe. So from this, it will be transmitted to parietal lobe for processing, understanding, and from there it will be transmitted to the frontal lobe for the production or giving the result of the understanding. Let us see that. So what has been seen or heard is sent to this vernix area. From here it will be transmitted with the understanding or processing in this parietal lobe, and it is moved to the Broca's area in the frontal lobe for the production, saying that whether I have understood or what I have to reply, and that will be replied, and the production happens from the Broca's area. So now in this slide you can see how the processing happens. From primary visual cortex, it is sent to the vernix area. From there it travels to Broca's area and it goes to the motor cortex for the response of what has been seen, and this is for speaking the hearing word. What I have listened will be sent to the vernix area, then what I have to answer will be processed and sent to Broca's area, and it has been sent to the primary motor cortex for the response. So, for example, I am looking at a picture with the word cat. So, I will be identifying the letter in this occipital lobe, and from there it will be sent to the vernix area where the understanding happens, and the process happens in the parietal lobe where we think what I have to give as a response, and it will be transmitted via articulate fasciculus, which we have seen in the previous slide, to the Broca's area for production, and now my brain will say I have to make it as and from there it goes to the motor cortex for the production. This is how our brain activates. This is what we call it as visual processing skill. So, the children with learning difficulties are always having an issue with the visual processing and auditory processing, because the neuro processing problem what they have in their birth or which has been developed in due course will be reflected in their reading, writing, arithmetic and attention, or these are base of auditory and visual processing disorder. So, the learning disabilities is an umbrella term for the problem which a child have in reading, writing, arithmetic and attention. So, the difficulty in reading is always termed as dyslexia. The children who have the problem in writing is called as dysgraphia. The difficulty in doing arithmetic has been named as dyscalculia, and the issue with the attention which the child has is called as attention deficit disorder, which we call it as ADD, and also the child who has a hyperactive problem along with the attention is called as ADHD, which is termed as attention deficit hyperactive disorder. So, these are the issues which come under the umbrella term learning disabilities, which has been a big issue in our school learning process, and this is a problem which has been often children with learning disabilities are confused with slow learners and mental retardation due to their poor academic performance and behavioral issues. This may mislead the educators in giving proper guidance for children with learning disabilities. The following graph shows a discrepancy between children with slow learner, children with mental retardation and learning difficulties. The first graph shows the steadiness in their gradation, getting marks in the two tests which lies in the same level in both the tests. But in the second graph you can see a fluctuation of marks attained by the same child in the two tests which has the same issue, which shows the problem of dyslexic children is not because of the cognitive level, but it is because of the processing issue related to language learning. Thank you.